We are back with our two healthcare experts, David CVA, the founder of North Carolina Serious Illness Coalition, and Josh Peck from Get America Covered. They're answering your questions about healthcare and benefits and enrollment. You can text your question to 336-379-5775. It's right there at the bottom of your screen. All right, David, this person is asking, what if I turn 65 this October, but I am still working and have a plan? Will I be penalized? I'm not planning to retire until the end of 2021.
Bottom line is that you always want to sign up for Medicare when you're eligible, that is at 65. And it's not that expensive. It's $144 and change right now, and it's not likely to change very much from that. And make sure you have your Part A and your Part B when you turn 65. That's the most important thing to recall.
All right, so 65, whether you're working or not, Part A and Part B. And this is kind of a follow-up question that someone else asked. I'm 65 years old. Is the 7-month Medicare enrollment you spoke of applicable if one is still employed full-time and has company-furnished health insurance?
And yes, you still want to make sure you've got your Part B. We had a friend who didn't think they needed Part B and ended up having a heart attack, and they were very, very surprised at the costs that were incurred that followed on. And there really isn't any way for you to undo that. Get your Part A, get your Part B, and make sure that you've got your coverage.
Yeah, in case you missed it, if you don't enroll in time in Medicare, then you're going to be paying at least a 10% penalty every single year on your premiums for the rest of your life. And you don't want to have that money out of pocket for no reason. All right, right. Josh, this person, oh, go ahead.
I was just going to say, and you can use your employer coverage as your supplemental during that period then. So there is still some advantage of allowing you to have the employer coverage.
I guess there's nothing about having too much health care coverage. No such thing as that? No. Okay. All right, Josh, this person is texting, I might lose my job by the end of the year. What should I do about insurance now? Because I have insurance now, but what happens if I lose it with my job? And they've missed the enrollment period.
Yeah, there are a number of life changes that qualify individuals for what are called special enrollment periods. And these special enrollment periods are triggered when these life changes occur. So if you have employer-sponsored coverage and you lose it, it creates a window of time where you will be eligible to enroll. For other examples of these kinds of changes, getting married, moving, or losing a job are three very common ones. What I recommend you do if you qualify for any of those is go look at the details, look at how long you have, and then when you do, when you do leave your job, that'll be the time to go and enroll. So you don't actually have to enroll during open enrollment.
Mm-hmm. This person says, if you make below $13,000 a year and are now disabled, how can you get health care, or not disabled? Make below $13,000 or not disabled, how can you get health care?
So I can try and answer that. So, in North Carolina, sort of Medicaid is the answer in many places to sort of that question. But I believe that in North Carolina, and I'm unfortunately not an expert on North Carolina, David may be able to answer this. I don't believe that coverage is available. But David, do you know that?
It really depends on what your financial status is, as well as, and I think the question was that if you're not disabled, so there's very few options until you become Medicare eligible at this point, because we are in a state that does not have Medicaid expansion. So there are some real challenges there for people that are not Medicare eligible yet.
Mm-hmm. This question is, my daughter will turn 26 in May 2021, and she will then be without insurance. Can she apply for the marketplace now, or does she have to wait?
She can apply now. People between the ages of 18 and 64 are eligible for marketplace coverage. The Affordable Care Act did create the ability for people up to the age of 26 to stay on their parents' plans, which of course has been very helpful for a lot of people, but that doesn't prevent them from applying themselves on the exchange for coverage. So anyone between 18 and 64 can go to healthcare.gov and apply today.
But let me ask you this, because they may say, well, that's going to cost me out of pocket, for a couple of months where I'm already covered. So because she's getting off her parents' insurance, is that enough of a life change? Does that qualify to then be able to do open enrollment in May when she needs it?
That is correct. If you lose coverage, that is a qualifying life event. Again, you should go and look it up before it happens so you can be prepared and make sure that you meet the deadlines that are required. But losing coverage is a qualifying life event that will make them eligible for something called a special enrollment period.
One more follow-up question to that. When she does that, if you sign up on May 25th, does it start May 26th with your coverage, or is there like a grace period there?
No, it does not start right away. Typically, if you enroll. There's typically a 15-day delay, depending on the exact date that you enroll. So usually it's the start of the next month, but there is a little bit of a gap between when you apply and when it can take effect at the start of the next month. So again, I think enrolling by the 15th of the previous month lets that effective date be the start of the next month.
Yes, good advice there. Okay, we are going to have one more segment. We'll be right back after this break.